Hello folks! Today I'm going to go over my long distance first aid kit. These are the first aid supplies that I carry in my extreme distance get home bag. I'm going to go with an overview first and then we'll go into each bag individually. So starting on the upper left, I have my basic boo-boo kit from my EDC. Then I have my major blowout kit. In 20 years of bicycling, I've seen some really wicked wipeouts and some really nasty injuries, so it does make sense to me to carry a blowout kit. And then next to it I have blowout kit resupply, because with the extreme distance I'm not sure when or if I would be able to resupply over several weeks. Then I have refills for my boo-boo kit, some topical bags, and then I have a SAM splint along with miscellaneous tape and ace bandages and pro wrap. So we'll go over all of those in detail next. So in my Coleman first aid tin, I have a small sewing kit, 4 pieces of moleskin, a couple sting relief medicated wipes, some cleaning towelettes, some triple antibiotic ointment, a couple packs of Bo9 chewable anti-nausea pills. These are a lot better than Dramamine. Miscellaneous band-aids, a couple butterflies, a couple knuckle bandages, some safety pins, some rubber bands. I have Purell. Again, for those stomach issues and stress, some Pepto, and in the little Nalgene bottle, some Tums. I have some chapstick, some aspirin, some vitamin C drops, and some Hall's cough drops, as well as a small mirror. Helps you look at injuries on your back or on the back of limbs. Some Kleenex and some wet ones for basically cleaning dirt off of wounds. Next, this is what I carry in the emergency first aid kit for major injuries on the outside of my backpack. First, I have a set of shears to cut through clothing, a pair of nitrile gloves, a pair of cleansing hand wipes, several antiseptic wipes, some gauze pads for cleaning around the injury. Then I have QuikClot and a tourniquet for stopping bleeding, followed by Steri-Strips to keep the wound closed. Think of these as butterflies on steroids. Surgical pad to again pack the wound and absorb any bleeding, a 4-inch Israeli bandage to wrap it, along with a 4-inch gauze wrap. So I have an H&H bandage and some medical tape there to secure everything together. The forceps I have there because they're great as a little third hand when you're trying to wrap bandages and keep everything in place as you're trying to tape things over. So for me, they're more of an aid than they are a surgical instrument. And then I have an extra survival blanket just in case someone might be going into shock, or I might be going into shock, to wrap yourself up in. Next is the refill for my major injury kit. I have some additional QuikClot, a Celox A with plunger applicator, some Hyphen chest seals, and a decompression needle. No clue how to use those. Hopefully if I get hurt that bad I run into somebody who does. I also have a cat tourniquet, so that gives me a second tourniquet. I have a cold pack, another H&H bandage, another 4-inch Israeli bandage, and another 4-inch gauze roll. Next, I have supplies to take care of a sprain or a broken limb. This includes a SAM splint, an ACE bandage, some self-adhering medical tape, a roll of gauze, some pro wrap, and some adhesive tape. The pro wrap you put underneath the adhesive tape so when you go to cut it free you don't rip off all your body hair. Next, I have topical medications. Starting from the upper left, we have suntan lotion, and then aloe for sunburns, mosquito repellent, and then Afterbite, Gold Bond, body powder, foot powder, as well as Body Glide to prevent chafing under your pack straps or in your boots. I have some poison ivy medication. Along the bottom row, I have iodine, some Neosporin, some triple antibiotic ointment, some Derbamond, which is basically super glue for your skin and wounds. And then I have some eye cleaner and an eye cup. Biking, I have gotten some dirt, grime, and bugs in the eye, and the eye wash is a lot better than just squirting yourself in your face with your water bottle. My final pouch in my backpack is a generic first aid supply bag. In here I have multiple pairs of nitrile gloves. Then I have a skin repair kit. This is kind of moleskin on steroids. Has multiple new skin packets as well as padded moleskin, as well as skin repair patches. In the next Ziploc bag over, I have miscellaneous bandages from small Steri-Strips, butterflies, knuckle bandages to large bandages. Then I have my Fresnel lens to help find splinters, ticks, small wounds. I have a bag of generic gauze pads. It has two 4-inch gauze pads, has eye pads, it has larger body gauze pads. I have a pair of tweezers. I have a CPR mask. And then I have a small little Ziploc baggie that has Q-tips, safety pins, and finger cots for covering wounds on fingers. I have some tongue depressors. Those are great for making splints for your fingers, applying medication. And then in the next pack over, I have miscellaneous ointment. So in here, I have cleaning wipes, antiseptic wipes. I have some burn gel packets. I have some diaper rash packets for chafing. So it's your basic topical ointment pack. So those were all the first aid supplies I carry in my extreme distance get home bag. What do you think? What do you think I should add? What do you think I should take away? What do you think I should get training on? I'm interested in your questions and your suggestions, so please leave them in the comments section. As always, thank you for watching, and please subscribe.